I want to show you first a little bit about what normal is. Sid is my perfect boy. Certainly not perfect in all things, but perfect as a demo dog. So I want to show you that every dog, every breed, if you take their front leg and you have their back and neck straight and his head down at 90 degrees, his front leg, I'm cupping his elbow with my palm and bringing his leg forward, and it should come up, right up. I don't know if you can see it because he's black, it's harder, but right to his eye. That's normal. So if your dog's leg can only come forward a little bit, something, muscle, fascia, something is causing a restriction. Every dog, every breed, I'm gonna bring your leg out, baby love. If he's in normal standing position, so here's his back leg, I'm going to now cup, I'm never pulling, I'm only guiding. I'm going to cup his wrist and come back. Every dog, every breed should be able to come to the knee. Then keeping their back totally straight, I should be able to cup his hock and come forward, keeping his pelvis in the same place, and he should be able to come up to his elbow. If he can't, then there's muscle or fascial restrictions. Now, just to give you a quick idea of some of the things that I work on with dogs, I love, 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 love my tuning fork. I can literally take it, and if I have a trigger point in the triceps, come in and put it on that trigger point, and usually within about 20 or 30 seconds, that trigger point goes away. And if there's a strain, so a tear in there, what's going to happen is all of the inflammation, because remember, sound and was going to work on the fascia, and the fascia controls the fluid. So the inflammation goes away, and I can feel that hard spot right where that trigger point, right where that strain or tear in the muscle or tendon is. I can also use kinesio tape. And this is big, I would cut it, but I can put it in places and it lifts the hair, right? Most dogs we don't shave, and humans, it probably works a little bit different, but in dogs we can use it and it pulls up to allow fluid underneath swelling to go down. We can also use it to help muscles stay in a contracted position. Now, again, without shaving, it doesn't work as well as it does in humans, but certainly it's a wonderful tool for people who know how to use it. He's doing really good. He needs a little treat. There you go, sweetheart. And then we have a whole bunch of myofascial tools. So I can tell you, because I'm a learning fool, I've gone through every course I could possibly do. So there's Graston, which is, they have a human course and they have the equine course. I've gone through the equine course. They don't have a dog course. And there's a whole bunch of tools. You can see my little toolkit here. These tools run about $1,000, but you can use them to work on the fascia. And there's all different sizes. There's different shapes. There's different roundness, whether it be really rounded or more sharp, to have different effects on the tissue. And we can decrease pain. We can turn them on, turn the muscles on if they're not functioning well, or turn them down if they're too tight. So the tools are great. There's also rock tape tools. This one is more rounded. This one is more sharp. So you have more of an effect with one versus the other. And then you can see the different shapes, right? So that you want to use the shape for the right body part, right? So what body part am I using? Which is the best place to use it? Those are also very expensive. I think in general, they're like $700. I think I got mine for like $350. And then I use something as simple as this. This happens to be rose quartz. So it has properties of a stone. I also have one with amethyst that's absolutely beautiful. But for the right areas, you can get great results, helping that superficial fascia break up and allow the skin to stop being stuck to the tissue underneath. And as you can see, the dogs absolutely love it. They're like, oh yeah, that feels good. And I know one of the questions you're gonna ask is how long is a treatment gonna take? And I can tell you that I have done a trigger point in 20 to 30 seconds, an area in several minutes. And when I was going through the Graston technique course, we did a horse and it took us 3 hours. But we took a horse that was competing to high level competing, which was just, I mean, we just over 3 hours were amazed at the difference in this horse. So that's my little demo.